So first and foremost, thanks to everybody at APDAWG, everybody at Our Dogs, and the UK Centre for Animal Law for making this webinar happen, and thanks to all the attendees for joining us. And with that, let's start talking about reframing discussions on dog health and welfare, what's needed for progress. I assume most of you know I'm Brenda Bonnett, a Canadian veterinarian and epidemiologist. I have a long history and career working in animal health and welfare as a researcher, educator, now as CEO of the International Partnership for Dogs. I have a long association with Sweden, with the Agri Insurance Company and the Swedish Kennel Club, looking at breed-specific statistics on health and disease. And this work, many collaborators have contributed to the development of IPFD and a lot of our work. Today I'll just thank Ian Seath, who is directly responsible for helping me with the roadmap we're going to present later. Let's start by talking about who is included in these discussions. All stakeholders that we feel have a stake in dog health and welfare, including kennel clubs and breed clubs and regulators, the public and individual consumers, researchers, academics, veterinarians, pet industry, the welfare sector, and any other producers and distributors. And hopefully many are represented on the call today, and we'll see that in the discussions, hopefully. So why now? Why now do we need to reframe our discussions? All of you are aware of many challenges in dog health and welfare, and many positive things have happened, but there's also been challenges. So you've heard of veterinary petitions in a couple of countries over the last few years, expanding legislation from many countries. And some of these efforts have led to confrontation versus collaboration. And we'd like to find ways to be more collaborative in our actions. Lots of discussion on social media can be good, but there's also an outrage culture, strong language, negative personal attacks, people feel vulnerable, and this doesn't promote good collective activities. And in fact, we tend to hear from people at the extremes on social media, and we really need to engage people from the middle. And so we're going to ask each of you to step up, even if you're in the middle. And all of this, are we on a slippery slope with a big snowball coming at us? Are there unintended consequences of some of this? That's what we're going to talk about over the next little while. So instead, perhaps we can promote collective and collaborative efforts for common goals, open, respectful dialogue, have discussions based on evidence and understanding, and a little less on emotion, and profile the many positives about dogs and people so that all our conversations are not driven by problems. What's needed for progress then? What are our goals for today's discussion? Well, we want to highlight the big picture and connect the dots of complex issues, not the complexities just of the health issues, but also of communication challenges. Identify some benefits of inclusive and collaborative rather than unilateral efforts, and identify individual, organizational, and collective responsibilities. We want to reach out to those who might be willing to embrace dialogue and collective and collaborative approaches, and hope they agree with us that together we're stronger with better outcomes. But of course, we have to also look at barriers that impact possible solutions, and that involves situations, attitudes, and more. We want to start a roadmap to achieving goals for dog health and welfare. And this is a call to action for the good of dogs and people together. Why are you hearing this from IPFD? We are an international multi-stakeholder organization. We have an aim to bring the dog world together and to move from information and collaboration to action. Hopefully you've seen our platform, dogwellnet.com. There's a wealth of information there on many issues tools, etc., genetics, brachycephalics, and our reframing document is there if you haven't read it already. We have the International Dog Health Workshops every second year. The last one was in the spring of 2019, hosted by the Kennel Club in Windsor, where we bring together decision leaders from all stakeholder groups to try and promote collective actions. Our focus is on health, well-being, and welfare of pedigree dogs, other purpose-bred dogs, and all dogs. And we have a focus on human-animal interactions. Well, let's talk just for a minute about actions. We tell people to think globally and act locally because, of course, your local situation is of key priority to you, but you fit into the global dog picture. Nationally and internationally, there's been many commissions, reports, blogs, educational activities, legislative activities on many issues, including breed-specific health issues. And we can say, have there been meaningful, substantive, and measurable outcomes? As I'll talk a little bit later, it may depend on your point of view, whether things have been enough and fast enough. And on that issue, we've been working on a chapter on international brachycephalic efforts for a textbook out of RVC. And brachycephalics have been on the veterinary radar for over 50 years. So the time frame is worth thinking about and looking at. This is a graph of AKC registrations for French Bulldogs 1970 to 2017. Similar logarithmic increases have been seen in many countries. So the popularity of these dogs has exploded, while many campaigns and educational and research efforts have gone on to inform people about health issues in these breeds and short lifespans. Other great research by Rowena Packer and others on people's attitudes about these dogs, and we start to understand that when they're getting these dogs, their priority is not health, and in fact, they normalize health issues as typical for the breed. So many challenges to getting the message across to people, and this dog, I took her picture when I was in Chicago, a dog compromised not only by its breed and conformation, but also by the fact that it's obese. So why are some of our concerted efforts just not getting through to people? It has been suggested to me, maybe by devil's advocates, that maybe it's time to say that is it that people don't know about health problems in dogs, or do they just not care? And that has to be looked at a little bit carefully because we have to define what care means, because maybe they don't care in the same way as everybody else. But there have been suggestions that in trying to eliminate smoking, it moved from raising awareness to true education, providing statistics, and eventually into legislation, restrictions, and even shaming. And the point of looking at this is to say who and how decisions get made about promoting health and welfare improvements has to be considered, especially if we're not sure we're making the progress that we hope to see. So another goal today is to move into the future with specific plans. If we're going to have a roadmap, we have to understand where we're starting from, where we want to go, and of course, who is or should be coming along for the ride. So we have this wide group of stakeholders. Think we agree that we need to talk to each other, that the problems of health and welfare are complex enough that together we're stronger. But maybe what we really need to do is to start by listening to each other. So definitions of words matter, and we're going to go through how there's a spectrum of diversity for terms, approaches, attitudes that bear on how we move forward on dog health and welfare. So if we have a spectrum, we might say health is the absence of disease, and some legislative programs in Europe have suggested that breeders should not sell any dog that might have a health problem. Well, that's a little unrealistic. Maybe we should be talking about the absence of preventable disease or an acceptable level of disease. And then we have to talk about rate and risk, and is it numbers or risk relative to other breeds. And because of confusion of how we talk about quantifying disease even, we may not be as effective as we want to be. Welfare, of course, we could call that good welfare is the total absence of pain and suffering. But again, who lives their life totally free of any kind of suffering? And maybe we should be focusing on adequate or acceptable welfare. But the point is, it's not black and white. Not everybody agrees on this, and these terms have to be clarified. And we run into problems if we generalize too much across diseases, across breeds, across regions, because there's so much diversity. So this attempt to simplify sometimes leads to unintended consequences. And in all of this work, we have to think about supporting good human-animal interactions. People are part of everything to do with pets. And so the complexity of the human-animal interaction has to be considered in plans and strategies as well. We think there's some kind of spectrum or balance between what's good for people, what's good for pets, but how do we achieve that? We've seen with the pandemic puppies, this incredible increase in people getting puppies. Sources of these puppies may be questionable. Prices have gone through the roof. But the real reason behind this is, of course, the people and what they want far more than what might be good for dogs. This isn't right or wrong. It's just we have to accept that this balance influences the success of anything we try to do, etc. So let's talk some more about the spectrum of roles and relationships between people and dogs that may be very different regionally and culturally. So again, we have a spectrum. Some people, some places identify dogs as sentient beings that have rights. Some people would push that to the point where dogs' rights should be basically equal to those of humans. On the other side, we have people and regions that consider dogs as property or chattels, and the owner decides about ownership issues, about breeding issues, etc., possibly within some limit of actual abuse. In America, no, in the United States and in Europe, there is a focus on trade and business, and people's livelihoods may come above the rights of individual animals. So across the spectrum, maybe we're talking about from dominion over animals to stewardship for animals. But everyone who's working in this area needs to be very clear in their own mind where they exist on each of these spectrums. And when we're communicating or doing collaborative work or designing interventions, we need to think about the target group for those interventions and where people are on those levels. And our efforts will be much better if we're at least clear and honest and aware, I would say. Talking a little bit about the possible spectrum of collaborators, we have campaigners, welfare organizations, informed politicians, and others who promote excellent dog health and welfare. Perhaps they put the dogs first, but they also honor human-dog interactions. And there's those in the pedigree world, for example, in the show community, truly committed to health and welfare, acknowledge there are issues that need to be addressed, and they take responsibility and want to maintain the best of everything in the pedigree world. Health is important to them. Both of these groups passionately committed to their beliefs, even though their beliefs aren't quite the same. And they may differ more on the magnitude and urgency of the problems rather than the problems per se. So that's another aspect in our planning. But all these people truly care about dogs and they care about dog people. These people could be collaborators, even though they constitute a spectrum. At the far ends of the spectrum, I'm going to just call these people crusaders. that might be extreme animal rights people, that might even be against dog ownership. Perhaps there's some in the extremes of the dog show world who think humans and their hobby come first, and health is secondary. Regardless what they're saying, their actions may indicate that. And if that's the case, um, and some of them are promoting true anti-dog legislation, or others are denying any responsibility for problems beyond their own dogs and feel collectively society doesn't have a say, then maybe these people will not be part of our audience for collective and collaborative actions. And what we need to do is accept that we need to focus on the people who want to participate. Another spectrum or range that I think is important to this discussion is the human behavior change wheel, and the processes people go to as they're changing a behavior for themselves or their animals or whatever. And this says if people start in a state of pre-contemplation, they may not realize there's a problem, and then they move into contemplation. Yeah, I think maybe I should do something. Preparation, they get ready. Action, they actually do something. Maintenance means they keep it going. And then, of course, there's the possibility for relapse, and they may start again at pre-contemplation. But we hope that with the right support, people will continue in a cycle of behavior change for whatever problem they're trying to make a difference in. If we view that as a spectrum, people who we want to interact with about dog health and welfare problems exist along a spectrum as well. Some are pre-contemplation, denial, no interest, or not ready for change. Some are already acting. They need support or facilitation or help with maintenance. They're already committed to the issues, and everything in between. If we think of applying some sort of legislation or regulations to a specific health or welfare problem and don't consider the target audience, we may say, well, we've got to go with the worst of the worst. There's people not denying there's even a problem. We're going to come up with some legislation that is restrictive or punitive because these people have refused to address the problem. The challenge then, of course, becomes, what if these legislative efforts then are also applied against people who get it? There's a problem. They're working on it. They're trying. What is going to be the impact on those people of restrictive or punitive regulations when they're already working on it, trying? It's not what they need to move them forward. And so this is one way in which we see unintended consequences of legislation or regulations when they aren't targeted appropriately for the group who needs them. So then sometimes the challenge isn't the legislation per se, but it's to whom it is enforced, and it's maybe not an appreciation of the diversity across this spectrum. So, looking at all this diversity, the spectrums that exist in terms of dogs and people and ethics and attitudes and laws and freedom and willingness to embrace change, can appreciating this diversity help us to evaluate previous efforts and create new ones? Can it help us to move from this to this? And most importantly, what's your role? How are you going to evaluate, reevaluate, and participate going forward? So now we're going to do a couple of polling questions and have some discussion. So, great. Welcome to part 2. So we've had some positive examples of collaborative efforts, and this is just a reminder to say that even if this love for dogs and care about their health and welfare exists along a long spectrum, and if individuals and groups along that spectrum each enact their own efforts, we should, through open dialogue, be able to tie this together into coordinated actions in the best interests of dogs and people. So a reminder that these are complex problems, issues of health and welfare in dogs, and bringing in the human-dog interactions and people side of it, really complex. We're not to be blamed for looking for simple solutions, but we must be aware that if we limit our scope or inclusion of other stakeholders, we may also be limiting the effectiveness of our solutions. And a call that any actions designed should be based on evidence, and do they include metrics and monitoring? Because we hope that in another 10 years we've got a clearer picture on what's working and what's not working, what's been most effective. Revisiting our chart of all the stakeholders in dog health and welfare, now let's look at responsibility in terms of the big picture. So up on the right-hand side, of course, we identify the public and individual consumers as responsible for dog ownership and care. And many educational programs have tried to raise awareness and facilitate people being responsible dog owners, learning how to responsibly acquire or rehome pets, and how to find healthy dogs from good sources. Many efforts in that area. How effective? Well, we'll come up with an example in a minute. On the left-hand side, we talk about responsible breeding, which of course we have a lot of expectations for kennel and breed clubs in supporting the production of healthy animals, and that may involve health testing and breeding decisions at an individual mating level, but also stewardship of breeds for their sustainability and preservation in the longer term. Every producer of puppies should also be involved in responsible sourcing and distribution. And of course, our ability to connect with different kinds of producers sometimes limits our efforts. And again, are we hitting the right target group? Now, of course, everyone has responsibility. All the target groups have responsibility beyond the specific examples here. And let's face it, what we're really talking about here is supply and demand. And I would say there's been a little bit of an overemphasis on focusing on the supply side in an effort to force breeders to supply healthy puppies. But as I say, often an overemphasis on kennel and breed clubs that, depending on the country, may supply 5, 10, 20, maybe 30, in a few countries, higher percentages of puppies that are acquired on a yearly basis. And so thinking that breed clubs and kennel clubs, even if they all produce the healthiest puppies, would revolutionize the entire population is probably a little bit overly optimistic. And on the demand side, we probably all believe that demand is what fuels this, but we're challenged to really create this behavior change in the public. So again, we focus more on the supply side. So we do simplify it to the two sides. On the supply side, do kennel clubs and breed clubs have the influence so they're the greatest proportion of supply? No, they don't. But the worst of the worst are hard to reach, and therefore there's a tendency for programs to be aimed at the people you can find. Not wrong, but may limit the effectiveness. Do we really know also how much dog shows and the dog show world create and influence the demand and desire for specific breeds versus probably a pretty major role of the media and celebrities in guiding what people want? But again, if we could change the demand and have the demand be for healthy puppies, then we would hope that producers would respond. I think sometimes we're a little over optimistic in saying buy from a good breeder and make sure you see the puppy with its mother. I know there's some fantastic efforts at legislation going on in the UK right now, and it'll be interesting to see how they pan out. But I worry sometimes that we have a lack of appreciation for the extent of online purchasing, the extent of other sourcing options, and the creativity of suppliers. And just again, the fact of are we willing to embrace the fact that if we could eliminate every uh, online source and commercial breeder, we would reduce availability to the public by 70% in many or more in many countries. Are we willing to do that? But we need to look at the complexity in that way. But as long as there's demand, someone will supply it. We've seen this in the pandemic. Even kennel club breeders, many increasing their production of litters, and we can't help but wonder the level of responsibility given urgency, travel restrictions. Did health care tests get done? Not so sure. So another spectrum we have to consider is there's no such thing as good versus bad breeders. Breeders exist on a spectrum, and we have trouble to truly identify quality of breeders and sources, although there are some rehoming groups that are working hard to try and develop some sort of an audit system. But KC breeders shouldn't get an automatic pass that they're all good quality. And there's a health management program in the United States working with medium-sized commercial breeders that has the excellent potential to improve the quality of puppies coming out of those sources. So again, it's complex. There's a spectrum, and we need to be able to differentiate across these groups. Now, if we have an audit, it doesn't necessarily help us if we still left with a demand situation of people wanting what they want when they want it, and that their priorities are looks and personality, and the priority of, oh yes, of course I want a healthy animal from a good breeder, may actually be lower on their priority list than we tend to think. And it all sort of falls apart when they just want what they want when they want it. So we have to deal with the reality of consumer priorities. Another added level of complexity is to consider the level of organization at which you're operating from the global down through regional, country, and local stakeholder level, because actions at even a local level may influence up the chain, and local stakeholders can benefit from information and understanding the context of their activity in relation to other levels. And on DogWellNet, we're very keen to have reports of people's experiences, what worked and what didn't work, as we try to increase the tools available for those working at any level. But context is important and sharing is important, is the message here. And in the reframing document, we'll have lots more specifics on what activities and are at each level and how they can relate with each other. In the last few minutes of the presentation, before we have more discussion, I just want to introduce you to the roadmap concept we're working on. So again, addressing each of these many stakeholder groups and identifying specific actions they can undertake individually that will improve collaboration and collective activities. This is a work in progress. I hope to have further discussions with some of the people on this webinar in the near future, and a detailed document will be available on DogWellNet, and we will be sending out the link to participants if they are interested in receiving. We don't have time to go through this in detail, but I just want to give some samples of what we hope to include in the roadmap document. There'll be a generic section where we suggest some reflection by each individual and all groups on their attitudes, ethics, and relations with other organizations, and especially how those attitudes form the basis of their actions and promote some specific activities that can be implemented immediately by individuals. And then we're going to go through for each group challenges, potential, and guidance with suggestions on how to evaluate previous work and ongoing work. And talk separately, for example, about breed and kennel clubs, and specifically pedigree and show breeders, but also each of the other stakeholder groups. And a call that we not get too hemmed in by rules and legislation. Of course, this is effective and important, and much progress has been made through this approach, but underlying it and knowing the challenges for enforcement of legislation, it's very important to engage a wider collective set of actions, and that health and welfare isn't determined by the legislation of a country, but by the enforcement of that legislation. And where gaps exist, we need other approaches. So I hope you'll visit us on Dog WellNet and communicate with us moving forward. Let's be sure we move into action, not just talking. Although having said that, we're going to do some more talking. We'll do some more polls and questions and answer. Thank you so much for your attention, and let's keep going. Thanks.